Now we are going to discuss about ECG patterns in ventricular hypertrophy or overload. I'll be concentrating on patterns rather than specific criteria for right ventricular and left ventricular enlargement. There are some named criteria, but this discussion will be on the patterns. This is the pattern in right ventricular volume overload, also known as diastolic overload. An incomplete right bundle branch block pattern is seen, RSR prime pattern, with usually STT changes as well, downsloping ST depression with T inversion. This is pattern seen classically in atrial septal defect, AST as this pattern, incomplete RBBB pattern in right precordial leads. In left precordial leads, this pattern is not seen. And in right ventricular pressure overload, the strain pattern is seen. Tall R wave in right precordial leads with ST depression and T inversion. The P wave may be prominent. There could be a prominent peaked P wave in V1 due to associated right atrial enlargement in right ventricular hypertrophy. And this is typically seen in pulmonary stenosis and any other cause for severe pulmonary hypertension. Pulmonary stenosis, it is right ventricular hypertension, and in pulmonary hypertension, it is also a great load for the right ventricle. Strain pattern is seen. In severe right ventricular hypertrophy, there could be associated deep S waves in lead 1, shifting the axis to the right. And there is a difference in pattern in different causes. In pulmonary stenosis and severe pulmonary hypertension, usually a tall R wave is seen in V1 and a deep S is seen in lead 1. That is a classical right ventricular hypertrophy pattern. Another type of right ventricular hypertrophy pattern could be in conditions like emphysema, where a small R and deep S pattern will be seen throughout the chest leads, and there could be deep S in lead 1 as well. That is a situation where this typical pattern may not be seen. In emphysema, because the heart is shifted downwards, even in the presence of right ventricular hypertrophy, this typical pattern may not be seen. This is left ventricular volume overload. This is ventricular pressure overload. It is also known as diastolic overload and systolic overload. In left ventricular volume overload, there is an initial narrow Q wave and a tall R wave in lateral leads. The correspondingly opposite pattern will be seen in right precordial leads. Deep S will be seen. And here in volume overload, the T wave is upright and a bit tall. So small Q wave, tall R wave, and upright T wave which is tall. That's the pattern in left ventricular volume overload, seen in mitral regurgitation, aortic regurgitation, ventricular septal defect with large left to right shunt, and patent ductus arteriosus with large left to right shunt. This is left ventricular pressure overload or systolic overload, sometimes called strain pattern also. This pattern, downsloping ST depression with the inversion of T wave, is known as the strain pattern. The initial Q wave is not that prominent in left ventricular pressure overload, and R waves are tall. This is left ventricular pressure overload seen in systemic hypertension, aortic stenosis, and subaortic stenosis, that is hypertrophic obstructive cardiomyopathy. These are the conditions in which you see left ventricular pressure overload. These tall R waves are seen in lateral leads. Correspondingly, there will be deep S waves in V1, V2 location. And corresponding to the ST depression T inversion, there will be slope upward elevation of ST with the upright T waves in anterior leads V1, V2.